At Compass Continuing Healthcare, we are frequently contacted by members of the public inquiring on behalf of a relative to ascertain whether they are entitled to continuing healthcare funding or not. Continuing healthcare funding is provided where an individual's need for care is primarily due to health reasons, and so not merely social reasons. This is a high standard of eligibility to satisfy, but the issue and the reason that we exist as a company assisting people in this situation is that individuals who are entitled to the funding are being incorrectly denied it. This can occur due to the fact that they're misinformed that they should even be able to apply, or indeed if they do get so far as an assessment, their needs can be downplayed or underscored so that they don't meet the criteria when in fact they should. We are able to provide assistance securing the funding by preparing the case in a manner whereby we secure all relevant evidence and cross-refer this to the criteria to set out the basis upon which the eligibility is clearly met. What we are being asked now and approached more recently is due to the issue surrounding the cost of living crisis that we're all experiencing. What isn't being talked about in the press is the fact that this cost of living crisis is being impacted on the businesses as a whole as well. Staff are requiring more wages to be paid, of course, to meet the cost of living, or they're leaving and finding better paid jobs. And so, of course, in relation to care homes, these are businesses as well. And so they are having to pay more to their staff to keep their staff. This in turn results in an impact on their financial bottom line. And where do they place this cost? Of course, onto the patients themselves. So their weekly care costs are increasing. Factoring in as well the fact that we all are aware the significant impact of increases in relation to our utility bills. This is even greater in business setting where the cost per unit cap that's always been in place and that we know is rising massively, albeit now capped by the government for individuals, is significantly higher again for businesses. Care homes are, by their very nature, large buildings with significant resources required to keep them operational, with electricity and gas for heating and maintaining, keeping the lights on. Again, these care home owners are having to meet these costs, and the only way they can do that is pass them on to their customers, who are the patients themselves in care homes. The net result we are seeing is that individuals who perhaps were paying £1,000 a week, which on its own is of course an extortionate amount of money in any other setting, are now being told that their costs are rising to £1,500 or £2,000 a week. We're very regularly seeing people who on average are paying a minimum of £1,500 a week for care, and this can often be as high as £2,500 a week, at costs now exceeding over £100,000 a year for an individual being in a dementia-led care home. It's very easy to see how a lifetime of assets that have been accrued, including property, can be spent in a very short period of time. What is essential is to ensure that a patient who is in a care setting is only paying for their care where they ought to be paying for their care. If it is established that the need for care is a health need, primarily a health need, then the NHS are obligated in law to step in and meet these costs by providing what's known as continuing healthcare funding. The problem is that this funding is not being provided to everyone that it should be provided to. This is clear based on the simple number of cases where people are successfully challenging incorrect assessments for their relatives' care. It would not be the case that decisions were being made to overturn appeals if clearly it wasn't the case the decision was wrong in the first place when they were assessed. There is no other setting I can think of where you wouldn't instruct an expert to assist you in a scenario where hundreds of thousands of pounds are at stake. Why should this be any different? I would urge you, if you have a relative paying for care with severe health needs, contact Compass Continuing Healthcare today. We would be able to go through with one of our experts on a free, no obligation, completely confidential basis what the particular circumstances of the relative in care are, and give you advice and guide you as to whether there's any possibility that they will meet the criteria, what the strengths of the case are, what the weaknesses may be, and give you an impartial view as to whether there is a basis to pursue an investigation for continuing healthcare funding. We can be contacted directly through our website, or indeed you can contact us by phone. Please don't hesitate to contact us. We'd be delighted to assist and go through matters with you. Thank you.